training is in public health.
And my name's Kyle. My training is in sociology.
And we are family planning researchers and advocates. We are here because our careers are dedicated to supporting individuals in our community with the ability to decide if and when to become parents.
Because parenting is no joke, and it isn't easy. There are pluses and minuses, amazing milestones and epic injuries, playtime and pink eye. And even when it's timed perfectly, pregnancy and parenting is a huge lifestyle and identity shift. That's why birth control is an amazing and powerful tool. We acknowledge that an unintended pregnancy in and of itself is not a bad thing. It's likely that about half of you in the room were the result of an unintended pregnancy. And perhaps you yourself had a surprise pregnancy and that child has filled your life with love and joy and meaning.
But for some, a mistimed pregnancy is the difference between finishing school and dropping out their junior year, or finding a job they like, or a partner they like, rather than settling for what they can get. Births that were unplanned or unwanted are more likely to have serious complications and negative social and health outcomes. But before we move on, we need to address the elephant in the room, or should we say, the super sexy elephant in the room. Healthy sex feels good and has mental, emotional, physical health benefits. Raise your hand if you've ever had sex for any other reason than to get pregnant. You're in good company.
On average, a couple who wants 2 children will spend 5 years trying to get pregnant or pregnant and over 30 years trying to avoid pregnancy. To achieve this goal, 99% of women have used contraception at some point in their reproductive life. And yes, all you straight men have benefited from contraception too. In 1965, the Supreme Court ruled that it was unconstitutional for the government to prohibit married couples from using birth control, and it took another 5 years to legalize birth control for unmarried women. We bring this up because it can be easy to forget that it was illegal for most of our parents and grandparents to use contraception.
So contraceptive research and policy was not always rooted in justice. Many poor women and women of color were controlled through reproductive coercion and forced sterilization, a reality which seems like a scene from A Handmaid's Tale. But we also know that modern contraceptive access has granted women across the world opportunities to self-determine. Contraception has drastically transformed women's health, relationships, sexual well-being, careers, and education. In the 70s, women who were able to get the pill were more likely to stay in college than women who didn't have access. And today, the majority of college graduates and earn half of all medical, law, and doctoral degrees.
But Utah has a ways to go. We have the nation's second largest gender wage gap, with women earning 67 cents for every dollar paid to men. Over a 40-year career, that means women lose out on over $500,000. And this gap's even bigger for women of color. Family planning supports closing the gender wage gaps. Thousands of Utahns are falling through a healthcare coverage gap, meaning they can't afford private insurance and don't qualify for public insurance. So for these people, an IUD costs more than they even make in a month. So they may experience an unintended pregnancy simply because they can't afford contraception.
So this is the problem our team of healthcare providers and researchers set out to address. Her Salt Lake is a partnership between the University of Utah and Planned Parenthood, and we engaged community members and received local and national support to remove all cost barriers to all methods of contraception in Salt Lake County for 1 year. We gave 7,400 people free birth control. And told them, if you don't like it, come back and switch on us. So when cost wasn't an issue, women were more likely to choose the most effective methods like IUDs and implants.
Many Hearst Salt Lake participants told us that they were having better sex, and they were able to let go more than when they didn't have to worry about getting pregnant. We're following up with these women for 3 years to, of course, make sure they're having great sex, but also to see if Hearst Salt Lake is helping them avoid unintended pregnancy and meet their educational and career goals. And we data nerds aren't the only ones who care about this research. Hearst Salt Lake has gained support from people all over the valley. Perhaps you're familiar with Charity Bingo at Beer Bar. Twice this year, hundreds of people came together at Charity Bingo to raise over $20,000 to help women in this community access birth control.
So we started Hearst Salt Lake as a local demonstration project, but we always had our fingers crossed that it would contribute to change on a statewide level. And guess what? Utah policymakers are reaching out to us for data and stories, so that they can better support their constituents who need and want access to birth control. State-level policies can either support or hinder access to contraception, and Her Salt Lake uncovered a need in our community and helped us address that need for more than 7,400 people. Maybe we're on the brink of a shift in Utah, where contraceptive services are a priority health issue.
We started in Salt Lake County and we're going bigger. Staying on par with Utah's motto, we're calling our statewide contraceptive initiative Family Planning Elevated. There are women in rural areas of Utah where there are 0 family planning providers. We're on a mission to train healthcare providers all over the state on contraceptive care. And we're helping connect women to health centers in their community where they can access birth control without geographic or economic barriers, because we strongly believe that women and couples deserve to choose if they want to become responsible for a tiny human that will poop in the bathtub.
So, a double stroller can elicit a variety of emotions. Maybe some of you see this and think, aw.
Whereas others see it and are like, ugh. It's because we are different. We have different backgrounds, different goals, and different ideal family sizes. But as a community, we can come together and support each other in having healthy and happy families.